Hi everyone, this is going to be a very quick video, actually an ethics video on the elements of informed consent. And the importance of these elements is that whenever we're determining whether a patient can make a particular decision, for example, when they are deciding to have a surgery or not, then we need to take all of these different elements into consideration when they make their decision to ensure that the decision that they're making is in their best interests and that they're the most informed that they can be. So there are four elements to deciding whether consent is valid, and the method that I like to use when memorizing these elements is VIC. So VIC is a mnemonic that defines these four elements. The V in VIC stands for voluntary. And that's pretty self-explanatory because essentially when we're making an informed decision, we want that patient to make that decision in a manner that they are able to essentially communicate their choices and they're satisfied that the choice that they've made is their choice. It's completely voluntary. They haven't had any external or internal undue influence on that decision that they're making, such that they are able to be sure that whether that be a particular test that they're being having a consent form done for, or maybe even chemotherapy, that they're 100% sure that the decision that they're making is their own decision. The second concept that we use in determining whether consent is valid is that the consent should be informed. And once again, this is something that is pretty integral because the patient should be informed of the positives, the benefits, the risks and the harms that come with each procedure. For example, if a doctor tells a patient that a particular course of medication is very beneficial for the condition that they're experiencing, but they don't say that the adverse effects are quite large as well, then the patient is blindly accepting the particular treatment that they are to receive. This means that they are unable to foresee and therefore effectively allow for a decision to be made because, say for example, if they were told about those adverse effects, it may have influenced if they take that particular treatment or not. Therefore, the patient has to be adequately informed about what they're taking. The third element of whether consent is valid or not is that the consent should cover the procedure. And this is a particularly important element of whether the consent is valid or not, because if the consent form does not cover a particular surgery, for example, then the patient has not agreed to what they're actually receiving. And even if a doctor argues that they fooled the patient into consenting for a particular procedure, even if it was beneficial, then this particular form of evidence would not hold up in a medical court because they have caused a particular harm to a patient that the patient has not consented to, and therefore even though a procedure might be beneficial, as the patient has not fully agreed to it, then the doctor has worked essentially against that patient's autonomy, and if there were any risks or harms that came from that procedure, then the doctor would be found liable for that. And the last element of consent, or determining a valid consent, is that the patient should have capacity. And capacity relates to whether the patient is able to actually make that decision, whether they're able to allow for a determination of the risks or benefits themselves, and whether they're able to translate or tell others that they have made that particular decision. Now, capacity is something that can change a lot based on the time of day, the drugs that the patient is receiving. Maybe the drugs are receiving, maybe the patient, sorry, is receiving drugs that make them drowsy, and therefore when they receive that dose, they may not have capacity to make a particular decision, but once that drug wears off, then they may. In terms of dementia patients, for example, there is a phenomena called sundown syndrome, where dementia patients have an altered state of consciousness when during the evening, as the name suggests, sundown, and therefore there are certain times of the day when these dementia patients are not able to make appropriate decisions related to their treatment. So whenever taking consent from a patient, their ability to make that decision must be effectively assessed at first. And this can be as simple as a simple questionnaire, asking the patient a couple of questions, or the patient may have to have a particular psychological assessment from a clinical psychologist to establish whether they are actually able to make these decisions by themselves. So in review, the 4 elements of a valid consent are: the consent should be voluntary, i.e. the patient should make that decision by themselves. It should be informed, meaning that the patient should be given all of the evidence, both positive and negative, about a particular procedure so that they understand it and are able to make a decision. The consent form should cover the procedure, because essentially consent is simply a form and evidence that a particular process has taken place. And if the particular form does not cover what the patient is agreeing to, well, then the patient has had an autonomy rights infringement, and therefore the doctor is liable for that. And finally, the patient should be having capacity to make that decision in the first place. If they don't have capacity, then if it's an emergency scenario, then the doctor can make the decision for the patient. Or if it's not an emergency, then the doctor may look at an advanced care directive, an advanced healthcare directive, or a substitute decision maker, which may be a member of the family, to make that decision for the patient. So I hope all of that has made sense today. Thank you very much for watching.